Hi, welcome to Dr. Medics. Anatomy of male reproductive system. The male reproductive system consists of external and internal organs. External organs are penis, scrotum, testis, epididymis, and parts of ductus deferens. All these structures are covered in the previous videos. If you want, you can check this in the YouTube channel. Now, internal organs are ductus deferens, seminal vesicles, ejaculatory duct, and prostate. Today, we are going to see about the internal organs. Ductus deferens. Ductus deferens is also known as vas deferens or deferent duct. The definition of ductus deferens is it is thick-walled muscular tube which transmits spermatozoa from epididymis to ejaculatory duct. It feels like cord-like structure at upper lateral part of the scrotum. Ductus deferens has narrow lumen except at the terminal dilated part which is called the ampulla. The length of the ductus deferens is 45 cm long when it straightened. Location and course of the ductus deferens. In its course within the scrotum along the posterior border of the testis. In inguinal canal as a part of the spermatic cord. Greater pelvis and lesser pelvis. The greater pelvis is the greener part and the lesser pelvis is the yellow part. The ductus deferens comes inward to outward from the seminal vesicles. See in the picture there is a lesser pelvis and greater pelvis. The ductus deferens coming inside out. The inner part of the ductus deferens is the lesser pelvis and the outer part near the pelvis in the rim which is called the greater pelvis. Course and relations of the ductus deferens. Ductus deferens begins as a continuation of tail of epididymis. Along the posterior border of the testis, at first it is very tortuous but gradually straightens as it ascends along the posterior border of the testis, medial to the epididymis. In spermatic cord, ductus deferens lies vertically in posterior part of spermatic cord which runs upward to superior inguinal ring, transverse the inguinal canal. In vertical part of its course can be felt as a cord-like structure within the spermatic cord. Fourth point is in greater pelvis. At a deep inguinal ring, it leaves the spermatic cord, hooks around the lateral side of inferior epigastric artery, and then passes backwards and medially across the external iliac vessels enter the lesser pelvis. In lesser pelvis, ductus deferens runs downwards and backwards on lateral pelvic wall. Deep to perineum, it crosses the obliterate umbilical artery, obturator nerves and vessels and vesicle vessels. Crosses the ureter and bends medially at right angles to enter the sacrogenital fold of peritoneum, reaching the base of the urinary bladder where the ductus runs downwards and forwards medial to the seminal vesicles, approach the opposite duct and reaches the base of the prostate. At base of the prostate, ductus deferens joined at an acute angle by the duct of seminal vesicles to form an ejaculatory duct. Part of ductus lies behind the base of bladder which is dilated and tortuous and is known as the ampulla. Blood supply of the ductus deferens. Artery supply. Artery to ductus deferens arises from the one of the terminal branches of the superior vesicle artery, which accompanies the ductus to the testis, where it anastomoses with the testicular artery. Venous drainage. Veins from ductus join the vesicle veins Venous plexus which opens into the internal iliac veins. Histology of ductus deferens. Lining epithelium is pseudo-stratified ciliated type. Underlying lamina propria contains elastic fibers. Muscular coat has three layers: middle, outer, and inner. Middle layer is circular, outer and inner layer is longitudinal type. Adventitia made of thin connective tissue layer with fine nerves and arterioles. The development of ductus deferens is from mesonephric duct. Seminal vesicles. These are two lobulated sacs situated between the bladder and the rectum. Each vesicle is about 5 cm long and is directed upwards and laterally. The lower narrow end forms the duct of the seminal vesicle, which joins the ductus deferens to form the ejaculatory duct. The seminal vesicle do not form a reservoir for spermatozoa. Their secretion forms a larger part of the seminal fluid. This secretion is slightly alkaline and contains fructose and coagulating enzyme called the vesiculose. Ejaculatory duct. Each ejaculatory duct is formed by the union of terminal part of ductus deferens and the duct of seminal vesicle at the base of the prostate gland. The ejaculatory duct opens into the prostatic part of the urethra below and on each side of the prostatic utricle and carries the formed seminal fluid into the urethra.